The question is that the amendment be agreed to, and I call the member for Layla.
Thank you, Deputy Speaker. Well, Deputy Speaker, Australia is famous for many things, and one thing the world knows about us is our universal health system and our affordable medicines. You know, when people look around the world at where they want to live, our great health system is one of the things that attracts them to our country. It speaks to our sense of egalitarianism, it speaks to our sense of social justice and our commitment to looking after one another, our commitment to building a fair society. Our universal health scheme is a hallmark of that great society, and I am really proud that Labor has had a role to play in the creation of that egalitarian health system, if I can call it that. And this legislation is another piece of legislation, another plinth in that great social enterprise that is our country, Australia, and one of the reasons why people from around the world want to come and live here with us. In my electorate, in Lalor, we have a young, diverse, fast-growing community, young families from around the globe who all love our health system. You stop on any street corner and start a conversation and it will go to health. Two planks, health and education. That's why people come to my community. Affordable housing, and I want a great education for my kids, and I want to know that we can access the health care that we need. And this government is committing to making sure that everybody in Werribee, in Tarneit, in Wyndham Vale, in Hoppers Crossing and Manor Lakes has access to affordable medicines. This legislation is part of that good news story. As of the 31st of July this year, my community has saved $19.2 million because of this government's commitment to cheaper medicines. And yes, $9.2 million. Because if you think about the young families that I represent, and if you think about the number of times they go to the doctor, if you think about all of the medicines that a family requires, if you think about our model where we front-load preventative health, where we front-load those preventative measures by creating access to GPs, access to emergency care, access to urgent care clinics, and we provide medicines that families need at affordable prices. You think about that, and you think about what that means in the long-term health of a community like mine. This is gold. It's more than gold. It's a spend we're not going to make at the other end of this cycle, because healthy children create healthy teenagers, create healthy adults. A Tarneit family filling 2 general scripts a month will save hundreds of dollars under the change that we just mentioned. This bill is providing certainty for concession holders. A Werribee pensioner will pay no more than $7.70 a script, frozen until 2030 with no surprises and no strings attached. Now, I think about my mum, who lived to be 94, and I think about what our affordable medicines meant in her life. They meant a quality existence. They meant a pain-free existence. They meant that she could continue to contribute, to hold her great-grandchildren, to see the birth of 28 great-grandchildren, down to our great health system. Seriously. 94 years of age, because she lived in Australia. 94 years of age. She had 9 children, 8 surviving. She was hard on her body. Her body met those demands. 94 years of age. And those medicines that kept her well. She was an asthmatic. Yeah, so as a child, she was an asthmatic who was told, her mother was told when she was born, that she'd have to be basically in the pram because the asthma was so severe. Not a treatment we would suggest today under any circumstances, but it's a long time ago. And that asthma came back. She grew out of that extreme asthma by the time she became a teenager. But with menopause, it came roaring back into her life, and she was hospitalised in her 60s, seriously fearing for her life. So her asthma medications were a permanent part of her life, from 60 through to when she left us, a permanent part of her life. How many scripts? How many scripts does that mean? What would that mean for her to know now, if she was 60, that it was going to be $7.70 per script on the PBS? Cheaper, longer duration scripts have also improved medication adherence, preventing avoidable visits to your GP and hospital admissions. These things are happening now under this Labor government, and I am so proud of the work we've done here. I'm proud that we stared down those opposite on extending scripts, stared them down and delivered it. I'm proud of it because I live with someone who has scripts all the time for a condition that won't change. And I know across the last 15 years the number of times a script went unfilled, the number of times I was in a conversation that went, colour's not looking great. Are you taking your meds? To be told, oh, yeah, I'm going to go to the chemist today. 60-day scripts will have prevented the heart failure intensifying for thousands of people in our community and will continue to do so. This is good news for everybody I represent. It's good news across Australia. Cheaper medicines help households in Lalor budget. But they help. I often talk about this. As a teacher, I have seen what cost of living pressure can do to families. Yeah, I've seen it. I've lived it with families, with kids who are walking into the school gate, who've come from a home where the bills are stacking up on the fridge and chaos is looming. Parents are losing control of their life, and that chaos impacts on young people as they walk into a school gate. Anything a government can do to create a positive budgetary frame for families to reduce the pressure of cost of living is a good thing. This legislation is not just about great medicine. It's not just about quality of life. It's not just about living longer. It's actually at that grassroots level of giving people control of their household budgets. It's a cost-saving measure. It's a cost of living measure, as well as being a health measure. This Labor government, the Albanese government, is providing practical, immediate cost of living relief with long-term benefits for every community. You think about it. We come to government. There's a cost of living crisis. Interest rates are spiralling. What do we look to? We look to the things that families need right now, control of the family budget. We look to controlling the energy costs inside their home. We look to the cost of medicine. What an insightful decision from our Minister for Health. What an insightful thing to do, to look at ways, to look at recommendations that may have come to previous governments and been shoved aside and said, not now, not important, not a priority for us. And in this scenario, this government comes into office and things are said, like the 60-day script, an idea rejected by the previous government and embraced by this government because what it means in a cost of living crisis. It means that you don't have to go to the doctor as often, and it means that we can protect that universal health system that we're so proud of. As a member for Lalor, I have fought to have the DPA status reinstated for my community, a status that was ripped away from us by the previous government, a status that saw a 30% drop in GPs in my community, because the DPA works in that doctors trained overseas, of which many live in my community, come and work, get a DPA status placement where they work longer hours or after hours, if you like. So a clinic stays open till 10 o'clock, staffed by an overseas doctor working to have their accreditation in Australia, their accreditation acknowledged in Australia. That is the bread and butter of GP clinics in my electorate, where we train clinics in Australian practice, people get their credentials, then they buy a house, then they dig in, then they start a practice, and the cycle continues. We've reinstated that DPA status in my electorate, and it is making a world of difference to community members, because lots of those clinics that are opened by those overseas doctors who've come to share their lives with us are bulk billing every patient who walks through the door. And now they're able to give them scripts that people can afford. And our pensioners and anybody who is eligible for PBS scripts is benefiting from all of that. This bill will reduce the PBS general co-payment from $31.60 to just $25 from the 1st of January next year. It doubles down on what we've already done to make those scripts cheaper, bringing them down to $31.60. Now they're going to come down another 20%. Another 20%. It will slash the maximum cost of PBS medicines. This is going to make another real difference in communities like mine, communities across the country. It was a commitment we took to the election because we know that universal health care is a part of Australia's identity. It's about accessibility, which provides the foundation for every cost of living measure this government introduces. We're using medicine, we're using health, we're using every measure we can use to assist families in electorates like mine to get control of that family budget. Literally, get control of their lives. Maintain a level of calm in their homes when they come home from work. Only a Labor government builds and defends this universal health care. From Whitlam's Medibank to Hawke's Medicare to this bill around cheaper medicines today. Labor made Medicare possible, and we are still the only party that strengthens it when families need relief most. Those opposite may wince, but Medicare stands because Labor built it and Australians back it. Labor just doesn't talk about universal health care. We created it and continue to modernise it. So Australians are not left to decide whether they can afford to refill their script or put dinner on the table. Not left to make hard decisions that people in other countries make every day. Every day. Under those opposite, what we saw was an Americanisation of our universal healthcare system, a system that we're incredibly proud of, that Australians are proud of, that it's a foundation of our society. It's a foundation of our egalitarian ethos. Labor founded the Affordable Medicine Scheme in 1948 under the Chifley government, with the aim to subsidise life-saving and disease-preventing medicines for the community. Today, this life-changing scheme has been expanded and provides timely, reliable and affordable access to necessary medicines for all Australians. In 2023, Labor delivered the largest PBS price cut in history, and now we're taking it down to $25. This is Labor doing what matters because it is the right thing to do. It's the right thing to do. It's the right fiscal thing to do. It's not just cost of living relief. It's just not good health. It's also part of that preventative cycle that saves governments money at the back end. The healthier our population is, the less demand on our health system, on our hospital system. When the Liberals were in government, we saw the neglect of our healthcare system. We saw the introduction of co-payments. We saw the freezing of the index for Medicare rebates. We saw them strip Lalor, strip Wyndham, strip the outer suburbs around the country of DPA status. This was a decision felt deeply by many in my community. I fought to have it reinstated. I support the Health Minister in the measures that he is introducing in this piece of legislation. I support the Health Minister in reinventing universal health care through the tripling of the Medicare incentive. I support the wise decisions being made by this government to keep not just my community but all Australians healthy, supporting them when they need support and making sure that every family across the country can access the medicines that the parents and their children and the children's grandparents and everybody in the community needs. This is Labor Government 101. Those opposite should take note. They should back universal health care. They should back cheaper medicines. They should support every measure this government is bringing forward to not just reduce people's costs but to keep our community healthy. Thank you, Deputy Speaker.